Subscribe now for easy-to-understand health tips, Dr. Madam. Imagine a slow burning sensation right in the middle of your stomach. Sometimes it happens after eating, sometimes on an empty stomach. The pain sometimes feels like a cramp, sometimes just a pressure, and you start to wonder, is it just gastric or is there something more hidden behind it? Today, we'll understand in very simple terms what a stomach ulcer actually is, why it happens, what symptoms appear, how it is diagnosed, and exactly how you can recover completely with proper treatment. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist and expert in diabetes and hormones. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, please subscribe to the channel because here you will get doctor-reviewed health information every day based on simple science. Stomach ulcers, which we also call gastric ulcers, are actually small sores that form on the inner lining of the stomach. Every day, powerful acid is produced in our stomach. Usually, a protective layer shields our stomach from this acid, which is necessary for breaking down food. But when that protective layer becomes weak, the acid starts attacking the tissue directly, and that's where ulcers form. Now, the 8 symptoms. The most common symptom is a burning or sharp gnawing pain in the upper part of the stomach. Some people notice the pain gets worse after eating, while others feel a hollow sensation as if their stomach is bloated with gas when it's empty. Repeated nausea, sometimes just retching like having the hiccups, sometimes actual vomiting, feeling overly full even after eating a small amount, and in many cases, experiencing heartburn as acid rises up and causes a burning sensation in the chest. But why do ulcers occur? The biggest culprit behind this is a bacterium called H. pylori. In about 8 out of 10 ulcer patients, this bacterium is responsible. It hides in the lining of the stomach, causing irritation, sores, and gradually leads to the formation of ulcers. Next, there are some common painkillers. NSAIDs like ibuprofen, naproxen, and aspirin, when used for a long time or in high doses, thin the protective layer of the stomach and increase the risk of ulcers. There are also some less common causes: smoking, certain rare viral infections, inflammatory diseases like Crohn's disease, and Zollinger-Ellison syndrome, where excess acid is produced in the stomach. And in very rare cases, stomach cancer can initially appear like an ulcer. That's why a biopsy is done, to be sure. Now the question is this very common? Yes, at some point in life, about 1 in every 10 to 20 people may suffer from a stomach ulcer. Fortunately, due to modern treatments, its incidence is much lower nowadays. However, if complications arise, they can be severe. The most concerning is bleeding. If there is sudden, heavy bleeding, it can cause vomiting of blood. If the bleeding is slow, the vomit becomes dark, resembling coffee. This is called coffee ground vomit. And if you pass black tar-like stool, which is called melena, that is also a sign requiring urgent medical attention. Another serious complication is perforation, which occurs when the ulcer creates a complete hole in the wall of the stomach. This causes sudden, severe pain and requires emergency surgery. In very rare cases, the ulcer can narrow the passage in the stomach and block food, resulting in repeated vomiting. For diagnosis, the first step is to check for the presence of H. pylori, either through a stool test or gastroscopy. Blood tests are also done to check for anemia or to assess the function of the liver, kidneys, and pancreas. But the main test is gastroscopy, where a thin camera is used to directly observe the inside of the stomach. Treatment begins with medications to reduce acid, such as proton pump inhibitors or H2 blockers. If taken regularly for 6 to 8 weeks, ulcers generally heal nicely. If H. pylori is found, antibiotics are added, because if the bacteria are not eradicated, the ulcer can return. If the ulcer is caused by NSAIDs, those medications need to be stopped. However, for some people, aspirin is essential for heart disease prevention. In such cases, doctors prescribe long-term acid suppression medication. Surgery is rarely needed these days, only if there is bleeding or perforation. In addition, certain lifestyle habits can be very helpful. Eating small, frequent meals, avoiding your trigger foods, quitting smoking, reducing alcohol consumption, and having dinner 3 to 4 hours before going to bed at night. 6 to 8 weeks after the treatment is completed, another gastroscopy is performed to ensure that the ulcer has completely healed and that there is no other hidden disease. The bottom line is, there is nothing to fear about stomach ulcers. If treated in time, they can be completely cured. Your body always gives you signals. If you just listen to those signals and seek treatment in time, you can return to a normal, healthy life. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic and NHS UK. If you find this video helpful, please subscribe and share, because awareness is the first step to good health.